So while waiting, I am here to make a video about today. I am here in the main laboratory in Gatineau, Quebec, where they accept walk-in um, blood testing. I didn't have an appointment for this. It's because it should be done um, once once a week in 4 weeks, in 4 consecutive weeks after my operation. So basically, I'm just making this video just to make myself productive by waiting for my number. Currently, it is P198 and I am P212. So I'm just gonna make this video short. So today, they're gonna check. I'm gonna submit myself for blood testing. They're gonna check my sodium, potassium, and creatinine. So basically, they wanted to check my if there are any electrolyte imbalances after they remove one of my adrenal gland, and they wanted also to check how is my kidney function because they included creatinine. So yeah, this is the first week, or this is actually the day 6 post right adrenalectomy. Everything went well. I feel like I've gained so much energy. They always say that after the surgery, you would notice a lot of changes. Well, you won't really notice that you are sick until that tumor or that gland has been taken out that causes too much production of aldosterone, a lot of stress hormones, a lot of I had a lot of weight gain, water retention, everyday fatigue. They call it adrenal fatigue, and I had like edema on both legs, bilateral legs. Yeah, just being tired every day. That's the main concern. That was my main concern, and another one is the increase in weight. Um, of course, I am still 32 years old. I am still, disturbed by the image, and yeah, I have puffy face, or they call it moon face. I have that. And I used to have a lot of pimples before, so those are basically all about hormonal imbalances. So we'll talk a little bit more about aldosterone. Aldosterone is a hormone secreted by your adrenal gland. Your adrenal, I'm not sure if it's adrenal medulla or cortex. Comment below. A lot of you are asking what is it for. It is actually a rare Con syndrome, or primary hyperaldosteronism, is actually a rare disease or condition wherein there is a tumor on your adrenal gland. So my case was a right adrenal gland, so I have overproduction of aldosterone, and it actually causes an effect to, as per my mentor before, Miss Rachel Camina. She mentioned that aldosterone is for salt, sex, and sugar. So I didn't have issues with my sugar because everything is well maintained when I had this condition. Sex, I'm not sure, but with salt, it's a lot. Even if I have to observe a low sodium diet, still I can have like edema on my feet, like every day, every end of the day. Imagine if you are working in a 12-hour shift. For those of you who may not know, I am a registered nurse, a full-time registered nurse. I used to work in a medicine unit, and then I quit and I moved to a different unit. I am now in the psychiatric mental health unit, in one of the hospitals here in Ottawa. So yeah, imagine if you have those long 12-hour shift and you're gonna be walking up and about to your patients. Patient bedside care. So yeah, so basically that's very tiring, very tiring. That's my main concern. Very tiring, like fatigue, over fatigue, adrenal fatigue. Like if you are trying to consider if you're working 12-hour shift and you have to go home for another 12-hour shift for the next day. So working full time here in Canada is like working 2 days and 2 nights. So you're gonna be working 12 day on the first day, 12 hours on the second day, and then 12 hours on the next night, and 12 hours. So it's 2 days and 2 nights consecutive in a row, and then you're gonna have 5 days off and back to your regular shift or regular rotation. So yeah, I am just so delighted and hopeful that everything's gonna be improving and everything's gonna be positive. So this is just day 6 of my post um, right adrenalectomy. It is November 21. What time is it? Today is 10:56 in the morning. I'm just here in the main laboratory here in Gatineau. I have to submit myself for a blood testing. So yeah, that's it for now. Stay tuned to my next YouTube channel. Thank you for watching. Bye.